Hey everyone, my name is Marie Huegel and I'm a current fourth year here at Southern College of Optometry, and I'm happy to welcome you to our first live virtual tour. As you can see behind me, we have the Eye Center. That is what we're going to be doing a tour of today, and it's directly connected to the tower, which is where a majority of first and second years will have their classes and labs, and third and fourth years, as well as some second years, will go ahead and come over to the Eye Center right behind me. All right guys, so we are in the Eye Center. This is actually where patients will go ahead and enter. They'll enter through here, they check in at the front desk, and then we'll go ahead and head over to the waiting room. So to tell you a little bit about the Eye Center before we just go ahead and dive in and look at all the different levels. So the Eye Center is actually 3 floors. The way it's set up is actually kind of like a hospital. We have different departments that all the students will rotate through, and then we'll go ahead and make sure we look at each level. So like I said, the Eye Center is 3 levels. It's actually the largest clinic of its kind in North America. It's the 2nd largest in the world, right behind China. So to give you just some updates in regards to how many patients we have on a regular basis. So the Eye Center will see around 350 to 360 patients a day. So that's over, combined with some of the other clinics around Memphis that we also will rotate through, that's over 60,000 patients a year. And all of those patient encounters just makes you a better doctor by the time you graduate, so you're ready to tackle on the workforce when you graduate. On this first level, we have our adult primary care. So as we're introducing ourselves, seeing how the patient is doing, we'll walk them to the exam room. So all of our suites are actually identical. That allows, if we ever need patient overflow or we need to change the way the Eye Center is designed, we have that capability. So as you can see, this is your standard exam lane. We have our slit lamp, the phoropter. Everything that you see here is identical to what students will be learning on. They'll be practicing on each other over in the tower. You'll be doing that first and second year. And then as third year, you can see this is your very standard exam lane. One thing that's really unique about SEO is that for our equipment, so say this slit lamp, all of our slit lamps do have teaching tubes. So I don't know if you've ever been shadowing and the optometrist will be, hey Marie, come check out this really cool thing that I'm looking at, and you get behind the oculars and you have no idea what they're talking about. So one thing that's really nice is that all of our slit lamps do have teaching tubes. It's a great teaching opportunity for both the student and the staff doctor. All of our equipment is different in each exam room, as well as all the different suites throughout the Eye Center. This is key so you get exposure to the different brands. All of the equipment does the same thing, but there's different ways. The knobs are a little bit different, so it just gets you exposure to the different types of brands, so that way by the time you graduate, you're ready to, and you have to purchase something, purchase equipment, you're able to figure out which brand you like beforehand. So with this adult primary care suite, as you can see, there's 4 exam lanes for 1 staff doctor. We do have a 4-to-1 ratio here at the Eye Center. So your entire patient encounter is a one-on-one basis. And again, with the 4-to-1 ratio with the staff doctor, you're never having to wait that long for the staff doctor to come check you out. If you have a question, they're always able to answer any questions. And it just makes it a lot of a cohesive unit. So this is a really unique room. So as you can see, we have an extremely large TV right here. So I kind of want you to take a mental picture of this room right now, because when we go upstairs next, we're gonna go ahead and see how this TV is connected to one of the exam rooms upstairs. This is a great teaching opportunity, which we'll go ahead and take a closer look. To tell you a little bit about the different clinics that we have throughout the Memphis area. Obviously the Eye Center is the major one that students will go ahead and rotate through, but it's not the only one. Students will actually have exposure to Focal Point, which is another, it's actually more like a private practice the way it's set up. And then we also travel to University of Memphis. We have a clinic over there, and as a third year, you actually will rotate through nursing homes. So you'll learn how to do an entire eye exam on a person who's laying down. We are up on the upper level. So on this floor, we have our Pediatrics and our Teens Suite down at this end. And on the other side, we have Ocular Disease as well as overflow of adult primary care. And behind me, we have our Technology Suite. But we're gonna go ahead and head down the hallway and look at that observation room that I showed you earlier. This is actually going to be one of the main areas that third years will be practicing, as well as fourth years are going to be practicing for their part 3 of boards. All right, so here's the room that is connected to that big TV that we saw earlier. So this might look like a normal exam lane, but this is actually really special to SCO. This is almost an exact replica of what you will see in part 3 of boards. The only difference is this within this past 2 years, they have changed the slit lamp. So this is not the main one that we use, but we do have that one in another suite that allows students to go ahead and get some practice on. But as you can see, we have 2 casino cameras. These are amazing because even when the lights are dark and complete blackness, they can still see all of these small little numbers. So this is just one of the things that is extremely important for students. To tell you a little bit about the board process, to become a licensed optometrist, you have to pass 3 parts to the board. The first board exam is going to be during March of your third year. This is where you'll do an online exam, basically of all of your didactic classes that you've had for the past 2 years. And then you'll take another part 2, which is another online exam, doing diagnostic and treatment that you'll do during your fourth year. During your fourth year as well, you'll take part 3. That's where every single optometry student travels to Charlotte, North Carolina and does a full exam, and basically every single skill that you have learned up until this point, you will do there. So this is just one way to lift that stress off of students' shoulders, gives them time to practice to make sure that they are ready to tackle those boards. We just entered through the main area that students and staff doctors enter the eye center. It's a little bit different because it's directly connected to the tower, so that allows students and staff doctors to enter into the eye center without having to go through the main lobby entrance area where patients normally do. All right, let's go ahead and take a look at Ocular Disease. So this is our Ocular Disease suite. As you can see, it looks the exact same as adult primary care. Again, this is just one of the importance of allowing the suite to go ahead and change departments if we need to, and make it very easy to have overflow patients. Next, we're gonna actually see one of my favorite rooms, but it might look very simple to you. So this is the fluorescein angiography room. Honestly, it just looks like your standard spectralis equipment that we have, but this is one of the main things that I love about optometry is, so with this room, we are actually injected dye into the vein, and it basically, we take camera inside the eye and we're able to see if there are any blood vessels that are actually leaking. This is huge. So in the state of Tennessee, we have injection capabilities. So during your second year, you actually will do injections on each other. Sounds scary, but honestly, it is very exciting. Given the fact that Memphis is in the South, the stereotype, very true. We do have a lot of our patients who have diabetes and high blood pressure. Take diabetes, for example. That is a condition that affects all of your small little vessels throughout your body. So if it's happening in your fingers and toes, it is absolutely happening in your eyes. So this is a phenomenal tool that we can go ahead and inject that dye into the vein and see if there's any leakage of those blood vessels happening in your eye. And these are one of the cool things about optometry is the only place that we can actually see live vessels in action and make sure that you are healthy. One of the things that I do love about optometry is the fact that there are so many systemic conditions connected to the eye that we're able to see, and this is just one example of how we're able to do that. All right, so now we are in the technology suite. So we're gonna kind of just go through and take a look at all of the different technology equipment that we have. We have a spectralis, basically all of the state-of-the-art technology. SCO does a phenomenal job of trying to stay up to date to make sure that any type of scan, picture that you would need to run, we have access to that. As you can see, we have 3 different visual field machines. We also have a B scan, which is extremely important for those patients who don't have access to being able to see in back of the eye. So with this B-scan, it is really cool just because if those patients come in and they have blood completely filling the eye, or they have a corneal opacity that you are unable to see back inside the eye to make sure that everything is healthy and normal, we have a B-scan, which is basically an ultrasound. So really cool that we do have access to that. If you need an anterior segment photo, we can go ahead and take a picture of that. If you have some type of lesion on the conjunctiva that you want to watch over the next couple of years to make sure it's not growing, you can go ahead and take a picture of that. We have an OCT as well as another OptoView. Here is an Optos technology machine that we have that basically will take a picture in the back of the eye if you don't want to have the patient get dilated. We have equipment from Maculogics to Color DX. These are phenomenal machines to scan and monitor for macular degeneration, or if they have any color deficiency. This is just one of the areas that students will actually rotate through. So to tell you a little bit about the different rotations, so third-year students will be in clinic 3 days a week, and fourth years, obviously they're in clinic every single day throughout the week. But as technology, third-year students will go ahead and rotate through here, as well as adult primary care, teens, as well as they'll get put in pediatrics as well sometimes, and just anytime they need to be elsewhere, they will. So students will go ahead and rotate through here. Usually technology you think might not be the best area that you would need to focus on, but again, if you end up owning your own practice one day or even just going into a practice, you need to learn how to do the technology. So now, even though your technicians are going to be doing that on a daily basis, you need to learn how to teach them how to run the machine, as well as make sure they're doing it properly, and make sure you're able to actually analyze the data that is being provided. We have a lot of staff doctors' offices. Now, all of our professors and staff doctors here at Southern College of Optometry are actually optometrists themselves. So this is a huge teaching opportunity for students, because when you're in the classroom, they are also seeing patients throughout the week. So this is huge for whenever you're learning something that you might not think might be actually beneficial. They have a phenomenal way of tying it into what you're going to be doing on a daily basis. All right, so now we'll go ahead and check out the residency suites. So here at SCO actually has the largest residency program in the United States. Now, to become a licensed optometrist, you don't actually need to complete a residency, but they are becoming very popular nowadays. So residency entails a one-year program where you're getting continuing education in a particular field, such as ocular disease, pediatrics, that kind of thing. So as you can see, very similar to what we have within our other suites. The residency suite, we have a lot of residents who are here on campus, as well as throughout the Memphis area. We have a total of 58 spots within our residency program, and that encompasses 14 different states. So even if you're doing a residency affiliated through SCO, it doesn't necessarily mean you have to be here in Memphis. So as you can see at the end of this hallway, up on the upper level, we have our pediatrics department and also our teens. SCO is one of the very few optometry clinics that will actually separate the two. So teenagers, they don't want to be looking at coloring books, and because they're studying more, there's a lot of binocularity and eye problems that are arising. Whereas with pediatrics, you just want to make sure that they're developing correctly. So the fact that we're able to separate the two departments, students will rotate through each area as well. This allows students to go ahead and make sure upon graduation, they have seen patients in every single department. So they have seen multiple pediatric patients, they have seen multiple teenagers, as well as ocular disease, contact lens, and low vision. So let's go ahead and we're gonna go downstairs and we'll go ahead and look at the rest of the eye center. So we are on the lower level of the eye center. Here we have our vision therapy, contact lens, low vision, and our ophthalmology clinic. And then we'll go ahead and end with the optical workroom. But first, let's go ahead and look at the vision therapy department. This does not look anything like our previous exam lanes. So you can see that there's balls hanging from the ceiling, there's bouncy balls. So vision therapy is one of the things that it connects the brain and the eyes together. So majority of your patients are going to be pediatrics, because to make sure that they're developing correctly. And then you also will have adults if they've recently had a stroke or were in a car accident. You're trying to go ahead and retrain those eyes to work together as a team and also connect it to your brain and the rest of your body. So as you can see, everything is very open. Now, every single skill that you will do in here, don't worry, you have done it before. You practice on each other over in the tower when you're doing your labs. So on the other side of vision therapy, we actually have our ophthalmology department. So we work closely with our specialty group to go ahead and partner with them with our local ophthalmologists. They actually are here a couple of days throughout the week. So they will do a lot of referrals for us. It is extremely important that you develop a positive relationship with your local ophthalmologist. So this is just another phenomenal way that SEO prepares you whenever you finally get out into the real world to make sure that you're able to have a great relationship with your ophthalmologist when you do referrals for, say, cataract surgery or lasers for whenever you're referring for diabetic retinopathy. So one thing that's really nice about having an ophthalmologist here in the eye center is we're able to go ahead and have them do some laser procedures for us. So we'll go ahead and take a look at our laser procedure lab. Very exciting and it's very cool. Let's check it out. So one of the cool things about having an advanced procedures suite here in the eye center is we will have ophthalmologists here, again, a couple times a week. So say you have a patient who has an angle closure, you're using multiple eye drops, you're using oral medication, and nothing is gonna help alleviate that pain from that increased pressure in the eye. Well, we have an ophthalmologist here who can quickly bring them here, do a perforated little hole with a laser, and able to alleviate his symptoms immediately. So just amazing the fact that we do have these capabilities here and that we do have the ophthalmologist that we get to work through directly. As you can see, we do have some TV screens. We have cameras that are hooked up to all of the slit lamps as well as the lasers, so that way you're able to actually see exactly what they're doing rather than having to be standing over their shoulder and making it uncomfortable for the patient. So that is the purpose of also having the observation room. So we are standing in the observation room of our advanced procedure suite. We have 3 different lasers here. We have an SLT, an argon, as well as a YAG laser. So optometry is a legislative profession, so that means that obviously your state is going to dictate what you can and cannot do. So in the state of Tennessee, we actually don't have laser capabilities as optometrists. That doesn't mean you're not going to be taught to the full scope of practice. So during your 3rd year, you actually have a lasers course, and we will actually get to go ahead and shoot the lasers. Obviously not on each other. We're gonna go ahead and be practicing on a cow eye, but it allows us to make sure that we have experience and are able to actually perform these if we do decide to practice in a state that does have laser capabilities. So those states are going to be Oklahoma, Louisiana, and Kentucky. Arkansas actually is in the process and has just decided to go ahead and have laser capabilities. They're still working on that process, but it just shows the fact that the state really does determine what you can and cannot do. So hopefully Tennessee does eventually get laser capabilities, but don't let that deter you. You will go ahead and be taught the full scope of practice. So on the opposite end of the lower level, we have our overflow, again, of the adult primary care, but then we also have our contact lens. So contact lens is one of those things that you definitely want to make sure you are well experienced in. Again, you can see the suites look exactly the same, but the equipment that we have is just a little bit different. So we do have a topographer. This is extremely important when you're dealing with cases such as keratoconus. You will learn how to do hard contact lenses as well as scleral fits. You'll be able to do that hopefully and usually on a regular basis. So we have an Oculus here. This allows us to do meibomianography as well as topography, which actually this is great that you can actually see what we have up here on the screen. You can see that we actually have these glands that are within our eyelids, and these will actually produce meibum, which helps with all of your tear film, and that basically kind of shows why this patient probably has dry eye. All right, so now we're gonna go ahead and head down to the end of the hallway. This is where our low vision clinic is. So we're not actually gonna go into an exam lane because again, you've seen multiple of those before, but we will go ahead and enter into the staff doctor's station because here is actually where we hold a lot of our low vision equipment. We have a lot of different magnifiers. So low vision is extremely important for those patients who say have macular degeneration and they have lost all of their central vision, or those patients who have end-stage glaucoma. Glaucoma is a condition that go ahead and you start to lose your peripheral vision to the point where you're only left with a little tunnel vision. So low vision is extremely important and one of those vital aspects to at least have some knowledge on so that you can help your patients see significantly better as well as are able to help them with different technology. So these are some really cool, these are actually Basically, they're computer monitors that you're able to go ahead and put, say, a reading, if you want to read a book, or if you're reading mail or a newspaper or anything like that, they're able to go ahead and hook up the camera to their computer screen and are able to magnify. And so these things are just extremely beneficial for patients who have lost a lot of their vision and are unable to do daily activities like you and I. All right, so we're gonna go ahead and take a look at our optical workroom. This is just another one of those areas that students, third years specifically, will go ahead and rotate through. Our optical workroom is one of those things where you actually will learn how to properly cut a patient's glasses. So this is where we'll go ahead and head up to next. On the main level, we'll look at our optical floor, but down here in the lab, we actually are able to verify the glasses to make sure that the patient's prescription is correct and for the right patient, as well as you'll learn to actually learn how to cut lenses within our machines. This is a vital aspect to go ahead and learn before you graduate, just because you are going to be doing this on a regular basis. So before we take our patient to optical to go ahead and check them out, if they need a follow-up exam or if you need to schedule a technology visit because they came in on vision and you need to go ahead and wait for them to come back so you can actually bill their medical insurance, we go ahead and bring them here to go ahead and schedule that exam. Our staff here does a phenomenal job at making sure all the paperwork, insurance, everything is good to go so that all we have to worry about is actually performing the exam. So talk a little bit about insurances. The Eye Center actually accepts over 500 different insurances. That's vision as well as medical. So we do not turn a patient away. So all of your patient encounters, you will definitely be making sure that you see them on a regular basis and are well prepared when you graduate. All right, let's go ahead and check out our optical floor. So here we have our optical floor. As you can see, we have a great deal of frames. We have frames that are very cost effective for our patients, as well as going up into our designer frames. So this is one of the very important aspects to have knowledge of before you graduate. So our third and fourth years will actually rotate through here on one of their clinic days. So here's where you'll actually learn how to properly pick a frame that fits that patient well as learn how to go through their insurance and see what actually is covered for them to make it very cost effective, as well as making sure they're getting the products that they need. So not only is it important to be able to make sure that the patient picks the correct frame that fits them well, but you also will learn about the different lens types. So whether the patient needs single vision, a bifocal, or even a progressive lens, you will learn about all the different types as well, and be able to actually talk to the patient and explain it to them on a very, not layman's term, but very easy for them to understand. So we'll go ahead and head into the workroom. So this is one of the, again, another rotation that you're gonna have here at the Eye Center. So this optical station, as you can see, we are definitely working on our inventory. So please excuse all of the boxes. But here is where you'll actually learn how to take a patient's frame that, say, they came into the Eye Center and the frame was just broken. You will learn how to actually put it together, make sure that you can actually use the tools that you will hopefully be using on a regular basis whenever you actually get out into practice, or are able to teach your technicians how to use not only the equipment, but as well to make sure that you can overall help your patient, not only with a comprehensive exam, but also with the glasses as well. All right, and here we have where we will take the patient and go ahead and check them out. As you can see, it is a one-on-one interaction with the patient. You will pick them up from the waiting room, have the eye exam, do the handoff, whether it's in technology to get any technology equipment used, or you'll bring them down to optical and have a handoff with them as well, and then you will finally bring the patient here to go ahead and check them out. That is everything of the Eye Center. Thank you for joining me on this virtual tour. If you have any questions, please go ahead and contact Student Services.